Wendell Potter is on the line with us. And boy, is that cool. WendellPotter.com, of course, his website. He is the former healthcare industry insider turned whistleblower and the author of a book called Deadly Spin, a former vice president of one of the largest health insurance companies in the United States. Wendell Potter, welcome back to the program, sir.
Thank you, Tom.
So just a simple question, and I think I already know the answer to this, but I wanted to reality test it. Somebody over on the DU board over the weekend was asking the question, if the federal government can't negotiate Medicare drug prices, but the VA can negotiate drug prices, why doesn't Medicare just buy their drugs from the VA? Now, I'm assuming that the answer is because Medicare actually uses the retail distribution system. In other words, my mother-in-law who's on Medicare goes down to the local pharmacy and picks up her drugs. And if it worked the way that was just described, she'd have to go to a Veterans Administration hospital to get them. And there's no mechanism for that. But let me just toss that to you as a wide-open question. Is there some way around this Medicare Part D provision that is a $600 billion windfall for the pharmaceutical industry?
Well, it probably would require a legislative change to the prescription drug benefits that went into effect in 2006. The way that was structured, the drug companies and insurance companies really came out looking great. And as a result, the Medicare program was not given the ability to negotiate with drug companies. Instead, if you sign up for the Part D, which is the prescription drug benefit, you have to do that through an insurance company, which then it in turn does negotiating with the drug company. So there's no consistency from company to company. You might be paying more for one drug if you're in Cigna and less if you're in Aetna. But that's why. It was because of the crazy way that the drug benefit was structured.
So it was structured in a way that not only benefited the pharmaceutical industry, and I've heard this number, $600 billion over a decade. Is that a fairly accurate number?
That's right.
Okay.
It's a huge, huge amount of money.
Okay, so it not only benefits the pharmaceutical industry, but it's also benefiting the health insurance companies because the money's running through their hands and they're skimming a little bit of VIG off the top?
You betcha. It's a big source of revenue and profits for insurance companies and for pharmaceutical companies. Keep in mind, the drug benefit was created during the Bush administration when there was a prevailing belief in the White House that the private sector could do much better than the public sector. But what we see as a consequence is that we're paying a ton more money for drugs and than we need to.
Now, when somebody's on Medicaid, which is the health insurance, Medicare is for people over 65. Medicaid is for anybody. In fact, most of your child health programs in the various states. In Vermont, Howard Dean called ours Dr. Dinosaur when I lived there. Yeah. These programs are actually Medicaid. Does Medicaid cover pharmaceuticals?
It does. It used to do it differently and in a more equitable way, and a way that saved the government and taxpayers money.
How?
Again, when the Medicare Part D program was passed, a lot of people who are in Medicaid are also on Medicare. Mm-hmm. They're called dual eligibles. So there's what the president most recently has suggested doing is trying to at least go back to the way it used to be when the federal government and the state governments would be able to negotiate with drug companies to get a better deal for the Medicaid population.
Right. So those Medicaid folks who are not dual eligibles, in other words, the 10-year-old who is the child and his parents who are in their 30s or 40s and working at McDonald's and making under the poverty line or working at Walmart or whatever, who's eligible for Medicaid. Those pharmaceuticals prices can be negotiated by the federal government. Do I have that right?
That's correct. That's
so,
correct. And with the states. The Medicaid program is administered by the states.
But they still pick up their drugs at the local Walmart or Walgreens or Rite Aid or locally owned pharmacy. Is that correct?
That's right.
So how do the retail distribution? How does Walmart or Walgreens? How do they make their piece of the pie on the Medicaid? It doesn't diminish their profit; it just diminishes their wholesale price and thus the retail price.
Well, yeah, their profit margins might be a little slimmer, but they still make money on it. They still are able to make some money, being the means of distribution of the medications. Of course, the drug makers make money as well too, and then there's other layer of middlemen called the pharmacy benefit managers make some money as well too. But it's a better proposition and costs taxpayers less than we see in the Medicare program.
And under the Affordable Care Act, a.k.a. Obamacare, those states that have said, like Rick Perry in Texas, we're not going to take your damn Medicaid money, their people will not be eligible for those lower-priced government-negotiated pharmaceuticals.
That's right. That's exactly right.
It's amazing. Wendell Potter, thank you for illuminating us and clarifying these issues. It's great talking with you. WendellPotter.com. Check out his site and pick up a copy of his book, Deadly Spin. It's brilliant. Thank you, sir.